Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership in Business podcast, where urologic professionals experience the practical application of business acumen essential for success in today's dynamic professional landscape. I am Dr. Micheal Darson, and in today's episode, we will discuss how advanced degrees empower physicians in urology. Joining me today for this discussion is Dr. Mohit Khera, professor of urology, and he holds the F. Brantley Scott Chair in Urology at Baylor College of Medicine. He's also the recent past president of the Sexual Medicine Society of North America. Dr. Khera, welcome.
Thank you. Thank you for having me on the show.
Well, let's get started. Let's talk about MBAs. That seems like a good place to start. How can one use an MBA in urology?
Well, let's think about this for a second. The number of MD, MBA programs over the past 20 years has tripled. This is becoming a very popular degree, particularly amongst physicians. I have to tell you, medicine is a business. Let's be honest. It's a business. And I grew up with a father who was a general surgeon. He was a general surgeon in the 70s and 80s. And he would tell me, he'd say, hey, if you have to advertise, you're probably not a good surgeon, because back then, great surgeons really, if you were really good, irrespective of marketing, irrespective of even bedside manner, if you're a great surgeon, you got the business. That is not true today. Today, social media, websites, marketing, just even the experience that patients have in your office will dictate, if patients will come to you. So the world has changed, and I tell people this because medicine has now really become a business. So think about all the things that an MBA would offer that you can use in your practice, and I want to kind of divide this up into private practice and academics because it's a little bit different. If you think about private practice, it actually makes a ton of sense, and it makes sense in multiple ways. It makes sense in terms of just the management, the operations management of the practice, how you market the practice, the finances of the practice, I think are very important. And very much so, many of those things also are germane to academic medicine. But academic medicine also, there's a lot of leadership that's required in terms of academic medicine. And we have medical students and residents, and you're leading a lab. And I also think that's very beneficial for career advancement. If you are in an academic world and you have an MBA, I do think that does help advance your career to the next level.
Okay, that makes a lot of sense. When did you get your MBA?
So I have a different route. So my MBA was essentially right after college. And back then, there was a very a great program through Boston University where I could do healthcare management. And the healthcare management essentially was that all of us would fly to Kobe, Japan. It was 42 of us all over the world. The Boston University professors would fly over 2 weeks at a time and teach the whole semester course in 2 weeks, fly back, and then 2 more professors would come over. And we did that for a summer. And then all of us came back. And then we only had to do 1 year as opposed to 2 to do our healthcare management. So it was a great program. Back then, there were 9 healthcare management programs, and BU just had a very intriguing one that I could finish in 1 year. And then right after that is where I was an analyst for 2 years in Boston, doing healthcare management as an analyst. And that's kind of what took me on down that road.
So you got your MBA right after college, and then did the analyst work?
And then I did the analyst work. So while I was working for Blue Cross, I was an analyst for Blue Cross Blue Shield of Boston, of Massachusetts. They had a program where if you wanted to get further degrees, they would help sponsor and pay for portions of that degree. And so at that point, I thought I would take advantage, and I got my MPH, my Master's in Public Health. So as I was an analyst, I was getting my Master's in Public Health. The issue is that as I was doing it and I was an analyst, my girlfriend at the time, who is now my wife, was at BU Medical School. And I did not like being an analyst. So I'm just going to tell you, I did not find it interesting. I just didn't find it very, very rewarding. It's for some people, they love it, but for me, I just didn't love it. I just came home every day and I said, what did I accomplish today? What did I do? And I couldn't see myself doing this for the rest of my life. I had to take I had to go back and take the prereqs of the medical school classes. And I applied, and I ended up going to the University of Texas, San Antonio. So I do think it's a different route. Most people will do an MD, MBA program, or most people would say, if you're going to do an MBA, get at least 5 years of work down on under your belt, and kind of have some experience, because it may add some more value as opposed to coming right out of, right out of college. You know what I mean?
Yeah, that's a very interesting path. So tell us how having your MBA led to being an analyst, and then what were you actually analyzing?
So when I finished my healthcare management program, there was a job opening at Blue Cross Blue Shield of Massachusetts as a healthcare analyst. And what I was doing was essentially looking at products. Let's say they were looking at a new product to help people reduce heart attacks. It was a new device. I would go and I would analyze the device. I would then give a return on investment. How many people would have to use this device? How much would it cost? And when will we get our money back? Right? So it's more deciding, is it a good investment to make into this device? Other things I would do is like preventative care. So they were saying, should we give people a gym membership? If we gave them a gym membership, then what would be the cost? And if they improve their health, theoretically, what would that give us back in return on saving money for healthcare? Right? So everything was like a return on investment. Go and analyze this, analyze that. So all I do is I'd go and look at different companies. I would look at different products. I would figure out how much it would cost for all the lives at Blue in Massachusetts, and then would it make financial sense, right? And that was the job. And it just I could do it for a while, but I couldn't see myself doing it forever.
What was your undergrad degree in?
I did Spanish and biology. And so those were
you had the science.
I had the science, and so I did, and I was very interested in going into medicine. I had to take a gap year, which kind of made me think about what did I want to do after I graduated from Vanderbilt, and so that's where it kind of was. Should I switch into something else? I always liked business. I mean, I do like business. I like the concept of business, and it's the finance, the accounting, the marketing, the HR. Very intriguing. And remember, what we do, the world revolves around business. The world is not around medicine. We're just a small fraction of what the world is. I mean, the world is business, and to understand how you can integrate business with medicine, I think was very, very important, particularly today. Even in academic institutions, gone are the days where you can spend all the day doing research, and then you can spend all day teaching, and you don't make that many RVUs, but you still get a good salary. That doesn't happen anymore. If I don't generate the RVUs, I don't get the salary. It's like, but I remember, like, even as a medical student, there were some professors that could, they're endowed and they got a nice life, and they can basically spend a little time doing academic, work, but a lot of their revenue came from just doing the research and doing the teaching. It's very difficult now to do that. I mean, you have to generate the RVUs.
What a unique lens to go through medical school with that history. I mean, that's you had to have instances where you were like, this is like a huge amount of waste going on here, but probably,
Yeah, I mean, when I came to Baylor, several years into it, they asked me to become the medical director, and I think part of it was because, and I've been the medical director now for 7 years. Part of it is because of the understanding of the way the business works. Like, think about it: from the second someone makes the call to come to our practice, to when they get the appointment, to when they get to the front desk, to how long it takes to get into the room, the experience that they have. When they leave, what's the follow-up? It's all important. It's part of the business. And, many times we don't think about that, but that is really important for the patients. And it doesn't matter. I say this over and over again. It doesn't matter how great the physician is. If the experience is bad, they're not coming back. It's just the way it is. And back 20 years, 30 years ago, if the physician was great, they could get away with it. You cannot get away with it today. You just can't. It
Yeah.
has to be a great experience on all fronts. And so one of my favorite classes in business school by far, this was my favorite class, it was called Operations Management. And what I had to do was I had to go to the post office and I had to time the second someone came in, how long it took, how many booths did they have, how long it took them to get out. At the end, then I would ask them about their experience. And it really is about just efficiency, just being very efficient. And I think many private practice groups have efficiency. They have to be efficient to survive. It's interesting if you look at the number of, if you look at healthcare practices throughout the United States, only 3% are led by physicians. 97% are just MBAs. But if you have the MBA and you're a physician, I think you're uniquely qualified to really help run these healthcare practices.
Yeah, as we're discussing, that's becoming more and more clear to me because, I left a private practice and, we were efficient, but I think it took many years to kind of get that knowledge and find out all those metrics that were really important. Whereas when you have an MBA, that it just accelerates the growth and understanding of that, and you can really hit the ground running. Whereas the rest of us that don't have an MBA, it takes experience and failures and all that kind of stuff to kind of gain that knowledge. So that's really interesting.
I think you're so right. I think there's other aspects about the MBA that people always think MBA and finance, right? MBA and finance. But there's some aspects of the MBA that helped me tremendously was really marketing. Marketing is so important. How you send the message out. Who do you send the message to? How do they receive the information? I think is really important. Advertising, these are, and now do we use social media? As people getting more and more apt and learning about social media, a lot of patients come in and say, I saw this on social media. I saw you were doing this research project on social media. I saw that you had an interest in this and you were doing this. And I saw you got, so I think people are using social media, but if you're not taking advantage of social media to market your practice, then you're at a disadvantage. And you learn these techniques when you're in a business school.
Yeah, I was just going to ask that. I would assume that today's MBA curriculum has to include social media and how to leverage it in your favor.
Heavily. So I have students now that are MD MBA students here at Baylor, and social media and using social media to market is extremely important. And what type of social media? I mean, certain things like TikTok is a younger population. Facebook is an older population. When do you release on certain days? Do you release Sunday morning? What Tuesday was a big, there's a whole art to this. Now you can hire somebody and that's perfectly fine. There are good companies you can hire. But again, it's really helpful that you also understand the strategy so you can work with the people that you hire because it makes a big difference.
Right. Yeah, I agree. So you had mentioned, some differences between academic and private practice. Let's just kind of dive off into the private practice realm. You mentioned management, operations, and finances could be improved by somebody that has an MBA. Can you give maybe some examples of that?
Yeah, I think that, look, at the end of the day, you have to know what every single thing costs in your practice. You got to know what the cost is if I use a disposable scope versus a regular scope. If I use a Botox vial, am I going to get paid? If I use Zyflex for Peronis, what is a reimbursement? There's an art, and you can hire people to do that. But when you also understand the numbers and you also understand the finances, it makes a big difference. It's not helpful if just the administrator knows that. It's also important to say, hey, tell one of my partners, if you don't use that scope and just waste it, we just lost $300. I just think you should know that. And as people become more accountable and they understand the costs, you'll find that there'll be less waste. I just think, it's a disservice that not everyone in the practice doesn't know what things cost when the items that they're using. You should know the cost. You should also know the revenue. How much do I make if I do this? How much do I make when I do that? The problem is that there's a discrepancy between private practice and academics. We get paid on RVUs. Whether you get a reimbursement of $1 or $10,000 on that procedure, I still get the same RVU. And that RVU translates into still the same amount of dollars. But when you're in a private practice, it's collections. Collections make a big difference. And so you have to understand, I think, in terms of the, so most of the academics, they all know the RVU of what they're getting, but it's also important to know really what is the total reimbursement for the practice. So think about the nuances, but about what you're getting from, practice management point. So financial is very important. Marketing, as I mentioned, is very important. But I do think MBAs do one other thing that you can use in almost any practice is leadership skills. They absolutely teach the course in leadership. And as you move up in academics or even in private practice, you are bound to have to use leadership skills. I mean, you're going to have to manage people, whether it be your MAs or your nursing staff or your, even your admins. You're going to have to manage people. In academics, we have to learn to also manage medical students, research groups, labs, basic science labs, which we do. And so that just adds to your leadership skills. And if you're a good leader and you can keep your employees and students medically happy, it pays dividends. If you're a poor leader, you get high turnover, it's really going to hurt your academic career. So leadership skills are extremely important.
Yeah, and one thing that we definitely talked about in private practice is along the leadership principle. If you have high turnover, it's also really costly.
Oh yeah.
And that's one thing that sometimes I don't think people link closely enough is leadership and the retainment rate and how that translates to your bottom line. So that's a really big point.
One other thing in academics also is that if you're trying to move up, let's say from assistant to associate to full professor, or you want to get involved with your college and you want to do more work, you want to get involved in committees, getting an MBA can make a difference. And it can also help with even actually with increases in pay. We may talk about this pretty soon, but we just submitted a paper to Journal of Urology that's getting reviewed, and I hopefully think will get accepted, where I worked with a medical student who had an MD MBA, and we surveyed all the MD MBA urologists in this paper that we could find, and to get their perspectives on, was it useful? And the majority would say it's extremely useful. 52% of them worked in an academic institution, which is interesting. So 52 were academic, 10% were in private practice, but 25% were medical students that when they got their MD, MBA. So it's different timings. But the reality is that almost 30% of respondents, when they did this, said they got their MBA, they did get a pay increase, and many would report almost a 20% increase in their pay. So there's a financial benefit in getting the MBA, I think, on the back end.
Interesting. You talked a little bit about an MBA and how it helps you network. Can you drill down on that a little bit?
Yeah. So most of the networking occurs with the people that you work with during your MBA, because you're it's almost like you're in this group of cohort of people many times for 2 years. You become very close, just like you're in college, and many of you have the same interest, particularly because you have to subspecialize. So mine was healthcare management. And so I still keep in touch with them. Majority of them actually, though, went into actually healthcare management, not very, very small fraction are in medicine itself. But I do think that having those networks, if you need something, if you need assistance, a question, in another health system, you have access to people that you're very good friends with, that you can pick up the phone and say, hey, what do you think about this? Does this make sense? And so it gives you a nice network. Even the university, Boston University, keeps their alumni very close as well. So if you want to call an alumni and have a question, it does give you a resource. So I do think that's very helpful.
So say, some of the folks listening to the podcast, they're like, that sounds really interesting. I'm interested in doing that. How does one go? I mean, how do you look for a good healthcare management MBA program?
So they're listed, and when I saw mine was listed. They're listed. I don't know if there's a central source. I have not looked recently at looking at healthcare management programs, but you always, when you apply, it's always important to ask, do you have a healthcare management specialty? There is healthcare management, and so I think that with the web, you're able to find this information. But I do think that if you are doing your MD, MBA, your urologist, getting a specialty in healthcare management makes more sense to me. You still are required to get the cores, which is finance, accounting, marketing. You have to do the cores. It's just like college. Everyone has to do the core, and then you can branch out into your subspecialty, such as healthcare management. But I just want to add one more thing. Getting the degree also helps you in your personal life, like my personal finances, my personal accounting. It's not just work. It's what I do and how I make decisions on how I want to invest. I mean, it's an essential tool for me, and it's helped me tremendously in how I make decisions on investing in things.
Yeah, what a great thing that you don't really think of right off the cuff when you think of an MBA. You think more, oh, how am I going to advance my career, academics, private practice, the finance? But that translates into your own private life for sure. That's a great point. Yeah.
I think it makes a big difference.
So you talked about you've got your MPH. Tell us about that.
So I think an MPH is a different angle. And when we talked about academic and private practice, this is where I think the MPH really helps those in academics more than private practice. And there's certain things in the MPH that I think were so invaluable for me. First was that there was a heavy focus on research skills, and it's really on biostatistics and epidemiology. You come out of an MPH really understanding statistics and epidemiology, which for me right now is extremely important. I mean, I have to use those skills when I'm writing papers, analyzing data, and it makes it extremely helpful. You have to also understand it's a heavy focus on prevention. So MPHs are on prevention, preventative programs, looking at broad scale programs to help the masses. And a lot of what I'm doing now, even where in sexual medicine, is prevention. So the same concepts are still there. There's a lot of focus on helping with grant writing when I was in my MPH, just learning classes on grant writing as well, and how to get funding, how to get external funding from government resources, private resources. Again, so I use that a lot today as well. And then do a lot of work also on healthcare policy. And so if you, the AUA has an advocacy summit, the SMSNA is very involved, and you learn a lot about healthcare policy through the MPH. So that really, I think, is important, particularly for someone who is interested in going into academics. It did offer me some really tangible and valuable benefit. I think in private practice, it can be interesting if that's what interests you, but it's not as valuable, I think, in private practice.
Right. So an MBA is roughly about 2 years.
It's 2 years, and MPH is also 2 years. Both can be condensed somehow. Most of the MD MBA programs are actually a total of 5 years. So that's pretty good, right? So you can actually get an MD and MBA together in 5 years, but MPH programs are typically 2 years, but you can also get them condensed if you need them to be. Interesting.
Well, this has been a very interesting conversation. I can't tell you how much I've learned, just particularly about the MBA and how it really translates. Because I've had a career in private practice and now in academics, and it's amazing to me how much benefit an MBA gives you in both worlds.
Yeah, but I agree 100%, and in your personal life. And again, like I mentioned earlier, the world revolves around business. And if you understand it, you better have an understanding of how it works. It will help you in personally and professionally.
Agree. Have I missed any big points that we need to make?
I think these were the big ones, and I really appreciate you giving me the time and opportunity to share my experience.
Yeah, it's been a real pleasure. Thank you, Dr. Khera, for sharing your time and expertise with us today.
Thank you so much.
And thank you to our audience for joining us on the AUA Leadership and Business Podcast. Until next time, continue to learn, lead, and excel.
Thank you for listening. If you enjoyed this episode, make AUA Leadership in Business your go-to podcast. Subscribe today by searching AUA Leadership in Business on your favorite podcast app and enhance your leadership and business education needs.